Hi, this is Cora Stack here, Dr. Cora Stack here again. I just wanted to, I'm on a kind of a bit of a roll here, and I wanted to talk about another um, burning issue that I have been raising online for years and years, and it's about the whole issue of burnout in working people. And as I've examined the issue, I can see how it affects huge suites of people more and more in our incredible fast facing world. So I have decided to write a policy paper on it and to again offer it for consideration. And I think I'm asking for a serious shift in policy. And the paper is attracting some interest from people around the world. And I think perhaps because again, it's resonating with, with people internationally, as a lot of my, my work does, in the background. I've got a lot of messages online from people all around the world saying I matter and that my work matters. And again, that's greatly appreciated because don't like too much attention focused on me. So let's. It's not about me, as I say. So let's just look up at my policy document that I have proposed for consideration and examination, critique, I suppose, but also perhaps for discussion or consideration by the people who have the power to now this work, it took me years to reduce to this policy documents. So it took a huge amount of papers. And if you go through my LinkedIn site, you'll see, or even Facebook, a huge amount of work on burnout. And I also looked at the whole area of gaslighting in life and that. And that was another area that I, didn't understand and worked on. And it's a very serious issue, a very serious trait or a very serious issue. But let's just look up at what I wrote here, and the policy document is called "Facing Up to Burnout in Ireland." A policy paper, and again I've edited with AI tools because it's excellent for getting rid of repetition and just highlighting your main points. So burnout, what I'm saying or have been saying or tried to advocate for years, is a public health, workplace safety and social justice issue. Across Ireland, healthcare staff, teachers, lecturers, frontline workers, nurses, how many frontline workers, carers, unpaid carers and students are experiencing unprecedented level of stress and exhaustion. Burnout is more than tiredness. It can lead to impaired memory, reduced creativity, and declining productivity, with long-term risks of anxiety, depression, cardiovascular disease, and dementia-like symptoms, something I'm very concerned about. I'm very concerned about how much I'm reading about the link between early burnout and dementia. And, if you're somebody like me who goes in to visit people in homes, in care homes, it's absolutely shocking to see the number of people in their 50s and 60s in these homes. And you're saying, is there anything that could have been done to prevent this? So this is what I'm shocked really at what I see when I go in to visit, elderly relatives. When I see the amount of young people that are now in these homes in the state, it's really shocking. And to think that what policymakers and what experts are saying, it is preventable, but what are the preventative, what is the preventative measures, who's responsible, and what can be done to prevent, or limit or mitigate or reduce the likelihood of dementia. So these are burnout is a huge factor, I believe, and I think that's well documented in the research. So I'm just talking about, again, I'm trying to reduce these points to the bare minimum so that they're understandable to the public at large, or people that can kind of get the gist of, rather than going into real detailed research, that could put people off, or they'd miss the point. So just the executive summary here is that burnout is a public health, or should be, public health, workplace safety, and social justice issue. So across Ireland, healthcare, all over the world really, the Western world, but we're just talking about Ireland, healthcare staff, teachers, the amount of teachers that are exhausted and that leave early due to burnout is, I think, is a real indictment of our policy. Frontline workers, nurses, the same thing. Unpaid carers and students are experiencing unprecedented levels of stress and exhaustion. I'm very much aware of the levels of exhaustion, for example, of students. Very much aware of it now, particularly post-COVID. Burnout is more than tiredness. It can lead to impaired memory, reduced creativity, and declining productivity, with long-term risks of anxiety, depression, cardiovascular disease, and dementia-like symptoms. International evidence from the WHO, OECD, and EU show burnout is now at pandemic levels. That's very serious. Ireland's current response focused on individualized resilience training. In other words, if you have a burnout or you're suffering exhaustion, it's your issue, your fault. It's your fault. This has failed. Structural causes such as excessive administration burdens, undervaluation of carers, over-reliance on high-stakes assessments in education, and workplace cultures that stigmatise vulnerability remain unaddressed. This paper calls for a national burnout preventative strategy. I'm burnt out from advocating burnout and the need for this strategy. So the paper calls for a national burnout prevention strategy, workplace reform to reduce administration overload and increase autonomy. These are significant factors contributing to workplace burnout. Recognition and support for carers, both paid and unpaid. Education reform to address student burnout. Health and lifestyle supports to protect well-being. Burnout is preventable. With the right policies, Ireland can protect its people, safeguard its economy, and build a more compassionate and creative society. So interestingly enough, I find it very interesting that the whole area of creativity can, that if you allow somebody that's working to develop their creativity in whatever way that's meaningful for them. And I think that's why I wrote the paper about mathematical identity in some sort of way. There is that element behind it as well, even though I didn't mention it in the paper, that if you allow people to explore their own creativity in their job, in whatever is meaningful to them, that they feel they have kind of control over that can mitigate or limit, or mitigate or reduce the effect of burnout. But this is a very important point that I'm going to make now. And this is perhaps is contentious, but I think, again, it's an issue that we need to face up to as a society. Burnout is often misunderstood as an individual weakness. So if you get burnout, it's your fault, there's something wrong with you, and you've got to sort it out yourself. A sign that somehow someone is not resilient enough or not capable enough, or etc., etc. In reality, burnout is a systemic issue rooted in the way organisations, workplaces and society are structured. The World Health Organization, WHO, defines burnout as an occupational phenomenon resulting from chronic workplace stress that has not been successfully managed. It is characterized by exhaustion and energy depletion, mental distance, cynicism or negativity towards work, reduced professional efficiency. The point I'm making here from the research that I've carried out, it's not just limited to to the workplace, although the WHO has recognised it as a workplace phenomenon. Absolutely not, because you can have exhaustion and energy depletion, you can have mental distance, cynicism, or negativity towards work, reduced efficiency. It depends, I suppose, on what you define as inverted commas the workplace. Maybe the home is the workplace for some. So perhaps the WHO, all we need to change here is what we define as the workplace, and then we'd kind of cover it all. In Ireland, burnout remains under recognised in public policy. Resilience training and employee wellness programs have been emphasised, absolutely, but these often shift responsibility onto the individual rather than addressing the systemic causes. A national reckoning is now required. That's a big ask. The scale of the problem. Workplace burnout, frontline professionals, doctors, nurses, teachers, social workers, academics are stretched thin. Increased workloads coupled with excessive administrative burdens leave little time for creativity, rest, or reflection. So rest, creativity, and reflection are the kind of, that fills the tank, and all the caring empties the tank. And what you need is a balance. And I think the point that I'm making here is very important, that Ireland burnout remains, and not just Ireland, other countries as well, but we'll just focus on Ireland at the moment. Burnout remains under-recognised in public policy. Resilience training and employee wellness programs have been emphasised, but these often shift responsibility onto the individual rather than addressing systemic causes. A national reckoning is now required. So let's just think about that. And maybe focus on that. And I think a lot of us would that would resonate with a lot of people. I think, particularly the people that are affected: the nurses, the doctors, the social workers, the academics, the carers. People in the home, even parental burnout. I was reading an article about parental burnout, the burnout of carers, of people with disabilities, and so on. All of that is covered here. Unpaid caring burnout, unpaid carers are the hidden backbone of Irish society. The care for children, older people, and those with disabilities, often without recognition, support, or respite. Carers report higher levels of isolation, exhaustion, and guilt. Many feel blamed for caring too much, when in fact their work sustains communities and reduces state costs. Student and youth burnout, something I'm very passionate about. Young people are increasingly at risk. Competitive academic environments, high-stake exams, and social pressures contribute to chronic stress. Early burnout impairs or can impair memory and concentration, and can mimic early signs of dementia. Now, I have a huge issue with this. This is where I feel that we really need to face up to this, given what I've seen in care homes. And I think anybody looking at this that goes in to visit a relative in a care home, say a parent, an elderly parent, aunt or uncle, that sees the number of people in their 50s, 40s, nearly 50s and 60s, it's absolutely shocking. I mean, it really is so sad. And so you're saying, this has to stop. There has to be a way of preventing this. I mean, there has to be a better way forward than this. Without intervention, Ireland risks damaging the cognitive and emotional health of its next generation. I mean, that is how serious it is. Then there's the economic and social costs. Absenteeism and presenteeism, that's a very good word. Presenteeism. Workers absent due to illness are present but disengaged. High staff turnover, particularly in healthcare and education. These are very places where there's a huge amount of caring And again, I feel, if you talk to nurses, teachers, or people in education, higher education, they would talk about the huge extra administrative burdens that are placed on them. Nurses say they have to, or even Gardaí would say that they're required to do a huge amount of administration, and that they didn't have to do previously, and that they're not able to do the jobs that they were, that they previously did and enjoyed. This is another very important one, in my opinion. Reduced creativity and innovation. Burnout stifles problem solving and initiative. This is another important thing. So that this is a circular one, I think, because the more opportunities for creativity people have, the less burnt out they feel, and yet the more burnout they have, the less creative they can be. So that's a loop, I think, that a burnout prevention strategy, a national burnout prevention strategy could address. The importance of having creativity embedded in the job description of each person in the workplace. And that is kind of individual control in some way, but also gives them a sense of personal satisfaction that they're working for the organisation and contributing to the organisational goals, but they're also given an opportunity to contribute in their own personal development goals, and that often involves some form of, inverted commas, creativity. So health and cognitive consequence. Burnout has short, medium and long-term effects. Short-term exhaustion, irritability, poor sleep, lack of motivation. Medium-term memory deficits, reduced concentration, withdrawal from relationships. Long-term depression, anxiety, chronic illness and possible dementia-like symptoms. And this, I just feel that the dementia, the idea that we could be working ourselves to dementia because of being expected to do too much in work by our society and by the failure of policymakers to have a burnout prevention strategy, and then the cost of that to society, and just putting our head in the sands again, I think is strikes a chord with anyone, with any bit of compassion or empathy or decency, are affected by somebody who's in a care home, that might say, "Oh, we could have, this could have been prevented if only." So we can only work going forward to try and do what can limit or prevent our exposure to burnout. Emerging with stress highlights that chronic stress affects the hippocampus, the brain's memory centre. Early burnout in youth and workers, if left untreated, can increase risk of long-term cognitive impairment. Now that's very serious. Why current approaches fail. Ireland's response to burnout has focused narrowly on individual fixes, resilience training, mindfulness workshops, well-being programs. Wellness programs, I mean, there might be, a few, online programs. This is scratching the surface, at dealing with the issue, in my opinion. This is not effective. I mean, it's minimally effective. While helpful, these approaches fail to tackle structural causes, excessive workloads, lack of autonomy, administrative overload, undervaluation of carers, and cultural stigma. Workers are left feeling blamed for their exhaustion rather than supported. International comparisons. Sweden, and Denmark. National stress prevention campaigns integrated into workplace law. Germany, employers required to assess and mitigate psychosocial risks. US, growing recognition of burnout in healthcare post-COVID, but fragmented approaches. Ireland, very limited systemic recognition. Workplace wellbeing programs are piecemeal and carers remain undervalued in policy frameworks. Ireland, lags behind its European neighbours in addressing burnout as a key structural and policy issue. Policy recommendations: a national burnout prevention strategy. This would require us to recognise burnout formally as a public health and workplace safety issue. Establish a burnout prevention authority linking the departments of health, education, enterprise, and social protection. Mandate monitoring and reporting of burnout across key sections. Workplace reform. Reduce administrative burdens on frontline workers. I think that would make a huge difference, this particular point, because we're hearing from nurses and Gardaí and teachers and principals and educators and so many people that the administrative burdens on them have increased hugely over the years, and they have no time to do the teaching, or they have no energy. Their energy is taking up in the wrong places. So protect time for rest, reflection, and creativity. So I'm very much into this, the importance of creativity to prevent burnout. Increase worker autonomy. That's giving people decision-making power in their workplace. Again, that's seen to fill the tank, if you like, rather than empty it. So burnout, what's happening in burnout is the tank, the energy tank. I see it as just a total breakdown or depletion in energy. So how do you fill the tank? If you're emptying a tank of oil, you've got to fill it again to fill it at one side, empty it at the other side. So the workplace reform: reduce administrative burdens on frontline workers. Protect time for rest, relaxation, and creativity. Increase worker autonomy and involvement in decision making. And promote hybrid and flexible working where possible. I know this is very contentious, but if it helps to reduce burnout, I think we need to consider this. I was just saying there that recently a person I greatly admire, a mathematician, has Brendan Gildea, who's educated Ireland's second level student for years and years. You would know these fantastic books, among others. He's very rigorous. He's extremely rigorous and passionate. But he was saying in an interview on RTE, I think, that, or one of those stations, that that in tests that there was a number of people over 30 who were showing difficulties with basic arithmetic, understanding with basic arithmetic, and he said the only place that this wasn't happening was Sweden, and we see Sweden here has a policy for burnout prevention, and also has a 4-day week. So perhaps what's underlying what Brendan Gildea is saying is that the fact that these people are having difficulties or impairment in terms of basic calculations, and it's not so much that they're not capable, but they're showing some signs of burnout. Work overload is the reason why possibly they're having such difficulties with very basic arithmetic. It's a possibility, and just looking here at Sweden, and that has a 4-day week, and it also has a burnout prevention, some kind of a workout prevention or recognition of burnout. Perhaps it's helping. It's helping. It's looking after people and looking after their brain health in a way that perhaps we're not doing in Ireland. And I'm asking that we should have a prevention strategy so that, in a few years' time, Brendan's analysis and results, or whatever the ones he was quoting, will be significantly downwards. Care recognition and support. I think legally recognise unpaid care as a part of Ireland's care infrastructure. This is contentious, but I think it needs to be addressed. Provide financial support, respite service, and mental health care. I think that this is very important for for carers, that they're not isolated, that they have access to, a lot of carers feel very isolated. And I think I have that in another policy, looking at the chronic issue of loneliness and social isolation and community breakdown. And isolation is a huge issue, particularly among these kind of carers, marginalised groups, which include carers and those looking after elderly people or people with disabilities and so on. Launch a public campaign, reframe care as a valued contribution, not a liability. Health and lifetime support. So this was something that I engaged in myself, out of my own research and reading a lot of the work on LinkedIn by experts, experts on this. Health and lifestyle supports encourage daily exercise, healthy eating, and adequate sleep as national wellbeing measures. Employer-supported access to wellbeing exercises. This is a key idea I have. Counselling, coaching, and rest spaces. Tax incentives for workplaces that adopt evidence-based burnout prevention. Now, I'd like to see, part of the things I'd like to see is workplaces having gyms, for example, or places where staff can exercise for an hour a day, for example, and this gets the brain, the circulation moving all around the brain, particularly in work where the work is largely sedentary and people are sitting down. If they're sitting down for 6 hours a day or more and not moving, then this is not good for the brain. So I think we need to be looking at that as well, how we can change the workplaces to help workers move during their work or between work periods. And there are simple solutions to this. It's just they need to be implemented. And I think exercise, regular exercise, is absolutely key to burnout prevention. And this is just reading right across all of the literature on it. And of course, sleep as well. Proper sleep. They say we're living in a sleep-deprived world, so that's another thing. With all the stress, people haven't enough time to sleep. Education and youth. Integrate mental health and stress management into school and university curricula. Reduce reliance on high-stake exams. Now, that point I'm making. I think we have to have exams, because if we had everything like continuous assessment, we'd have all AI. And I'm saying that we can have exams, but perhaps we have them. For example, in the leaving cert, I'm saying that we have the projects maybe in the transition year. We have 30% in 30% formal exams in 5th year, and 70 in 6th year. I think we can't, and in that way, reduce the reliance on one state exam, perhaps, not to have everything in one exam. But I think we need people to have thinking time as well. So if we're continuously assessing people all the time, they've no time for thinking, and that leads to burnout. So I'm just looking at that one there, and I'm thinking perhaps that's framed in a way that I'd maybe like it slightly adjusted, given what I've written in other policy documents. But I think that that has been a major driver behind the current Minister for Education's or maybe the NCCA's view. But I think you can have actually more stress on students by having them do continuous assessment continuously, and more pressure, and then all these exams or projects can put enormous strain in the system and lead even to a worse situation than high stake exams. I mean, I think you have to have exams, but you also maybe have to have them laid out, maybe not so many. But I haven't read research on this in terms of for example, I'm advocating that we should desemesterize first year and second year in the university system to give people a rest and a break, and but maybe to have some assessment, some assessment, between the years and that sort of thing, during the year, that sort of thing. But I think that if we don't give students time to reflect, think, absorb the knowledge that we're giving them, I'm also advocating that we should give students time out during the day to go to the library, so that if they're there in college for 6 or 7 hours, there should be at least 2 hours where they can rest, they can go to the library, they can read, they can just slow down their minds, and they can think about what's been they're being listened to. And the same in schools, and they do that a lot in England, but they don't seem to do it in Ireland. It seems to be 9 to 4. So this there's a fine balance here between overloading people with information, too many assessments, and then perhaps, as we're seeing here, perhaps having too many high stakes exams. So there's a balance there, I think, that we haven't got right and we need to work more on. Provide early intervention for student burnout, including counselling and peer support. But I think, early intervention is important, but I think we need to change perhaps our assessment, give students more time off during the day, encourage the exercise and build resilience, the sleep and all of that. And again, I think it needs to be our policies, again there needs to be that loop of monitoring and evaluation, etc., etc. So implementation framework, cross-departmental coordination between health, education, enterprise, social protection. Funding model shared across state, employer and social insurance contributions. Timeline phased out over 5 years with measurable indicators. Accountability, annual reporting to the Oireachtas on burnout levels and progress. So, conclusion. Burnout, this is the main point I'm making here, and this is I suppose, where I'm really trying to change the focus in terms of our thinking about burnout. And this in itself could help a lot of people, this particular vision. Burnout is not a private weakness, but a public responsibility. Ireland must shift from denial to recognition, from blaming individuals to building supportive systems. By controlling burnout honestly, Ireland can protect its workers, carers and students, safeguard its economy and model international leadership in building a society that values both excellence and humanity. Burnout is preventable. With the right policies, Ireland can choose compassion over complacency and growth over decline. And then the references are the World Health Organization, OECD, European Agency for Safe and Health and Safety in Work and Care Alliance 2023, and some work by the Irish Congress of Trade Unions. So there are just a couple of points there on another passionate issue that I have been interested in for many, many years, and that's the whole issue of understanding burnout, and in particular occupational burnout. But I also understand caring burnout. I certainly understand that as well, and I think it's very important that we bring the whole issue of caring burnout into the domain, including unpaid inverted commas carers. But there's more payment for carers now than there was before. There's more recognition of that, and that's good. But is there enough recognition of carer burnout right across the spectrum in terms of where it can occur? And I'm asking and suggesting that Ireland needs a national burnout preventative strategy, and this will be better for Ireland and society, and for all our peoples in Ireland.